Summer May Finlay. I'm a Yorta Yorta woman, and I'm here talking to Rebecca Johnson and Dion Tatow. Now, I don't know if I got that name right. I was a bit nervous after Rich just got it wrong. Yeah. And we're having a chat about LGBTQI+, sister girl and brother boys. And one of the things we were just talking about is how frustrating it is for people like myself who work in the healthcare sector not to know stuff that, quite frankly, we need to know. Do you guys want to have a chat about that? Actually, would you want to introduce yourselves first?
Introduce ourselves.
Sorry.
Hey, my name's Rebecca Johnson. I'm a Gurang woman from Queensland, about 4 hours north of Brisbane. I'm also the founder of Indigenous Women's Leadership and Support Group, and sit on a national Aboriginal and Torres Strait Islander collective called Tekwabi Years, all of us connected.
Fantastic.
And I'm Dion Tatow. I'm a human and Wodja man from Central Queensland as well. And I'm on the Aboriginal network, which is a Brisbane-based social support group for Aboriginal and Torres Strait Islander LGBTIQ+ sister girls and brother boys.
Fantastic. So back to the question about the things that health professionals really, really need to know. And you said something to me that was really important, was that we don't know this stuff as health professionals, and we need to know because this is about people's lives.
Yeah, sure. Look, I think there's been a lot of discussions and a lot of sharing of knowledge here at the conference, and we've been able to identify what works. But the opportunity for us to be with many of our mob from all over Australia is to identify what isn't existing and where are the gaps and what's not working.
Yep.
And that's where our discussion was leading, and it was around social and emotional well-being and the impacts that the impacts that LGBTIQ people face when they attend, the health centres or medical centres.
Yep.
And the medical centres don't have the capacity or the capability to work with Aboriginal and Torres Strait Islander LGBTIQ people. And in particular, our conversation was around unpacking access to binders, to hormone treatment, and having those discussions around what the capacity and the capability of our health services are. And can we do better at that? And how can we do better at it? Equipping our services to understand that when LGBTIQ people access our services, that they're in a safe service, that it's an inclusive service, and that people are trained to understand some of the issues medically for LGBTIQ people.
Fantastic.
And I think Summer too, in addition to what Becca said, Aboriginal and Torres Strait Islander people, we face discrimination in mainstream health services, and some of our Aboriginal and Torres Strait Islander LGBTI community have suffered discrimination, in our own services, so we need to be aware of that. And we also need to make those health services more welcoming. Have imagery that's relevant for LGBTIQ people, and make sure the staff are trained in how to ask the right questions around gender identity, because some people's gender identity is different to the mainstream, to the norm. So we need to, our staff of those services to be aware of some of the differences for LGBTIQ people.
Fantastic. And the other conversation we were actually having was around data and the lack thereof, and the importance of data. We might just walk. So the importance of data. So one of the things that you have both said independently is that there is a strong need for data, because if we don't have the data, then we actually don't know what services are needed. Can you elaborate on that a bit for me?
I guess a lot of the health services that you do see are in response to needs within the community. We all know that Aboriginal and Torres Strait Islander people have health needs in areas across chronic diseases, sexual health, mental health, are lower than for the general population, and we know that information because of data. So if we don't have the data in relation to the needs of our LGBTIQ+ community, then how can we develop, or how can we argue for services to meet those needs? I think that's the point we were making. Unless you collect the data, you don't have any evidence by which to base your submissions or proposals.
Fantastic.
And it's about visibility, I think, as well. Without us, looking at our data sets and being more inclusive of LGBTIQ, sister girl and brother boy people, we're creating a sense and developing a gap that is that creates invisibility for LGBTIQ mob. When we're not visible, we're not actually looking at our service provisions and who we're providing and articulating a service for. That's why we want to do it better. That's why groups like Indigenous and Garbunjalam and Mullugu Mob and all of the little LGBTIQ Indigenous groups all over Australia want to work stronger with all of our health sector to say, we want to be visible, we want to be included, we want to feel comfortable identifying ourselves when we walk into a health service. We want to ensure that we're being provided with the most accurate health to live healthy, well lives.
Fantastic. Is there anything else that you want to say to people out there? Any key take-home messages or anything you really want to stress to other mob listening?
I think just to have services that are inclusive of LGBTIQ people, get us involved in the developing and delivering those services. That's probably the key message, because we're not only impacted by discrimination based on our race, but also victims of discrimination based on our sexuality and our gender identity. So we need services that address our needs, and as it is with the Aboriginal and Torres Strait community, we need to be involved in those services to make them relevant, to take ownership of them, and to ensure that they meet our needs.
Fantastic.
Look, for me, I think it's visibility. We see a lot of health campaigns run nationally through all of our health organisations, and now is the time to walk beside and to come on the journey with Indigenous LGBTIQ people. We need to lift the profile with more campaigns. Our community, we need to lift the awareness in our communities so that our communities understand the issues impacting LGBTIQ people. If we continue to be invisible in our communities, we will continue to see increases in attempts and suicide and the suicide rates. A part of that process of us addressing social and emotional well-being is Indigenous LGBTIQ people being a part of the co-design of what goes on inside of our communities, being a part of the co-design of creating inclusive services and safe services for Indigenous LGBTIQ people.
Fantastic. Thanks very much, guys.